My first attraction to Christ Hospital was the vision that people here had to grow and expand the cardiac service line. And it was really the birth, I think, of what later became the Heart and Vascular Institute.
The need was there, the opportunity was there.
I saw a tremendous opportunity for growth and a wonderful community to serve, and it has grown into a referral center that is really unlike any other center in Chicago.
When I started in 1996, we didn't do any assist devices. In 1997, I think we did one. Last year, we did over 140. We've brought in research, new technology, new therapies.
The advances were so rapid that we even developed the fellowship program. And we have graduated more than 200 cardiologists.
We were one of the first groups to actually implant stent grafts for aortic aneurysms, and we're one of the busiest in the city in that regard.
We were one of 10 hospitals in the United States to get FDA approval for the robotic, minimally invasive heart surgery. We've made a tremendous commitment to the surgery for congestive heart failure, left ventricular assist devices, heart and lung transplantation.
Being named as a top 15 teaching hospital in the United States, it's really quite amazing to think that that's where this small community hospital started at and where we are today.
Finally, our institution can talk at the same level with the most advanced cardiac programs in the country, and perhaps in the world.
When you stop and look around at the things that we do here, it's really nothing short of medical miracles. You have patients coming in here with the worst prognoses. These patients were doomed. Now they're turning around and leading productive lives.
I'm looking forward to a future of not being sick any longer. I had such a problem with my heart. I could not even walk across a street.
Christ Hospital is the busiest cardiovascular program in the state of Illinois, and there's nothing really that's available within cardiovascular medicine that we can't do here.
It's right here, 24 hours a day, and the results are staggering.
Like any great program, it's really the people who make it special. Wonderful surgeons, nurses, technicians. It takes an enormous number of people working together in order to take the best care of the patients, and we're very lucky to have all that.
This is a rock and roll hospital, total enthusiasm, everyone pitching in together.
If you're in trouble and you need a rapid response, this is the place to be.
And all of a sudden, the one nurse gets in my face and she goes, "Okay, things are going to happen real fast. Don't worry, we got you." This one's taking my pants, sticking a needle in me, putting stickers on me. It was amazing how fast it happened. And Dr. Silverman came in and goes, "You were literally minutes from not making it."
If the patient ends up on our doorstep, they're going to be taken care of quickly and be well treated.
The staff here has been just wonderful, and that it makes the whole process much easier to handle.
They've helped my transition of being an unhealthy person to a healthy person, because I feel very healthy these days, and I couldn't have been this way without them.
I've always been proud to work in this place. That's why I've been here for as long as I have. And the people that took care of my mom were fabulous and made us all feel at ease.
I was not frightened. I was not upset. I think they just handled the whole situation in such a comforting way.
When you get the right group of people working together who care, who really want to do well for their patients, it just snowballs. It continues to get better. It continues to grow.
Once you get to a point in which you have reached the top, new needs appear, and it is a constant process. And that is why the contribution of everyone is so important.
Much of this technology is extremely expensive. Each heart transplant patient has an array of extraordinarily high cost, and without philanthropy, much of this would not be possible.
We could not have gone through our expansion to offer more care to more of our patients and their families without charitable donations. It is an absolute need, it is a growing need, and it is what will sustain us in doing what the Heart and Vascular Institute is intended to do.
I think that this hospital has the potential to be one of the places in the nation that you would want to go to for cardiovascular care along the same lines of Cleveland Clinic, Mayo Clinic. They talk about Christ Hospital.
Heart disease is still the leading cause of death and we're hoping to delay that with better medical care, and we hope to have the support to be able to continue, advance, and offer people new therapies so that we could make people better longer.
It's amazing because I've had a lot of people come up to me and I say, wow, you look so great. I say, I feel good. I mean, I kid around with them. I says, it's nice to have blood pumping in places I haven't had for a while.
I am a busy 85-year-old, and I love life, and I live it fully.
I'm only 41 years old, and I feel like I've got a lot of living to do. I'm just so incredibly grateful to still be here and be with my family. It's just a whole new life, and it feels so good just to be alive.